Good morning, everybody, and this is my part of video series called Your Question, My Answer. And here I have a question from Journey with Lupus. For how long should iron supplement be taken for iron deficiency anemia? Is it to be taken long term or indefinitely? Question mark. So, very interesting question and very common question. How long should one take iron supplement for iron deficiency anemia? Do you need iron supplements forever? Let's break down how long one should take iron and why. It's a very logical question. If you're on iron supplement, there's a timeline involved, and we're going to talk about that. Iron supplements are not forever until there is a forever iron loss situation. There are rare situations like that. I'm going to discuss that as well. Hello, everybody. I'm Dr. PK, and if you are dealing with iron deficiency anemia, you are probably wondering how long you should take iron supplement. The answer isn't forever, but it depends on the severity of the deficiency and the cause behind it. Today I'm going to break that down, the general timeline for taking iron and when you might need to keep going. Okay, so how long should you take iron supplement? For most people, iron supplement are taken for a period of 3 to 6 months. Now, this depends on the severity of your anemia and whether the cause of deficiency is ongoing. Here is how it generally goes. Number 1 is restoring your hemoglobin level. Number 2 is replenishing your iron store. So restoring hemoglobin level takes about 2 months. First step is to boost your hemoglobin levels. This only takes about 2 months, depending on how severe the anemia is, but there is some variation. And after this, you should be feeling better in terms of energy and overall health. Number 2 is replenishing iron stores. Can take 3 to 6 months, and that also depends upon the severity and the cause of anemia. After hemoglobin returns to normal, we usually recommend continuing our iron supplement for about 3 months minimum, sometimes even 6 months, to make sure iron stores, ferritins, are also refilled, right? It takes longer to bring ferritin levels back to where they should be. Now, when you might need to take iron longer, in some cases, you might need longer term supplementation. For example, heavy menstrual bleeding, ongoing blood loss in digestive system like ulcer or GI bleeding, low iron intake due to dietary restriction, malabsorption from conditions like celiac disease after weight loss, gastric surgery, chronic kidney disease, or dialysis patient often require long-term iron, usually given intravenously. How do we track iron levels? When you're taking iron supplement, your doctor will be tracking certain labs to see if you are improving hemoglobin levels. That improves first and should get back to normal relatively quickly. Ferritin, this is your iron storage level and takes longer to get back to optimal levels. Your doctor might also check another thing called transferrin saturation, which gives an idea of how much of iron your body is able to use. Okay, now here are the practical tips I want to give it to you. Best absorption tips: take your iron with vitamin C or with citrus or vitamin C supplement to improve absorption. Avoid taking with a calcium rich food or beverages, tea and coffee. If possible, separate iron and dairy or caffeine or tea for at least 2 hours to avoid interfering with absorption. When should you ask your doctor about iron supplementation? Now, if you find that your iron level need to be long-term, it's important to ask, why I'm losing iron? It's especially important for men and post-menopausal women to be checked for causes like GI bleeding. If you don't know why iron levels are low, it's a good idea to get further evaluation. To summarize, most people only need iron supplementation for a few months, but it can vary depending on the cause of your anemia. Make sure you work closely with your doctor to get proper testing, follow-up, care. And remember, it's not just about taking iron, it's about fixing the cause of the deficiency. So, thank you for watching. Please like, share, subscribe, and repost. And share with the people who may benefit from this kind of video. And I appreciate you listening to my video and ask any questions. Have a great Thursday. Thank you.